Hello, everyone, and welcome to today's webinar, How Today's Hospitals Can Combat Rising Labor Costs and Burnout. We're excited you could join us. My name is Leora Westbrook, and I'll be moderating today's event. I am the president of Workforce Strategy and Optimization, an AMN healthcare company. Today, we'll be doing a deep dive into what hospital leaders should know as they explore emerging models, such as float pools, that can help solve healthcare staffing problems. Before we get started, I have just a few housekeeping items. Please note the slides will advance automatically throughout the presentation. To enlarge the slides, click the Enlarge Slides button located in the top right corner of your presentation window. If you need technical assistance, click on the Help widget located on the bottom left corner of your console. We encourage you to submit questions at any time throughout the presentation using the Q&A widget at the bottom of your console. We will try to answer these during the webcast, but if a fuller answer is needed or we run out of time, it will be answered later via email. Please know we do capture all questions. Well, we are thrilled to also be joined by Michael Whedon, Angelo Vendetti, and Zach Master. To kick off, I'd like to ask each of you to provide a quick introduction of yourself and your work. Michael, would you like to go first?
Sure. Good afternoon. My name is Mike Whedon. I'm the Senior Vice President in the Vendor Management Division of AMN. I'm also the founding partner of B4 Health, which is one of the three AMN VMS technology solutions.
And Angelo?
Hi, good afternoon, everyone. My name is Angelo Vendetti. I am new to AMN as the Senior Vice President of Strategic Workforce Solutions, and the goal of my job is to help organizations rework their staff and really have less reliance on agency and travelers.
And finally, Zach.
Thanks, Leora. Zachary Master, Director of Project Oversight here at AMN. I've been in healthcare IT for 20 years, the last 6 at AMN. Today, we'll be talking about some innovative technology solutions that we're driving to market here as part of today's program.
Wonderful. Well, thank you all for being a part of this. Now let's get right to it. So, as we all know, hospitals are wrestling with a variety of labor shortages on top of many other problems like burnout, difficulty recruiting, and retaining clinical staff, among other concerns. And now more than ever, healthcare leaders should be exploring more flexible and agile models with respect to staffing. Becker's Hospital Review recently cited workforce challenges as the #1 problem keeping hospital CEOs up at night for the 2nd year in a row, followed by financial challenges. In fact, 81% of hospitals reported a vacancy rate of over 10% in 2022. Hiring rates are simply not keeping pace with the rate of turnover. Not surprisingly, 2022 was the most financially difficult year for hospitals and health systems since the start of the pandemic. Healthcare leaders are seeking versatile staffing models to reduce costs and optimize their workforce. This environment is ripe for workforce innovation as healthcare leaders explore various workforce models while driving retention to address the 25% higher rate of voluntary attrition in U.S. workers at pre-pandemic levels. Nurse leaders are challenged to provide emotional well-being and overall health of their clinicians. Developing a float pool consisting of qualified healthcare professionals willing and able to work in multiple units and locations can provide dynamic staffing along with the flexibility and growth opportunities that clinicians are seeking. Throughout our tenure as a premier labor management strategy organization for almost 30 years, we've helped organizations across the country establish high-performing workforce strategies that have yielded significant cost savings and staff satisfaction outcomes. We have proven outcomes and evidence that shows implementing key strategies are needed for long-term sustainability. These strategies include standard and consistent policies and procedures, centralized, deployed, aligning resources to the highest patient need, Applying forecasting to automation and having a flexible resource model is critical to achieve better patient and staff work-life balance. Establishing the cultural mindset to meet patient care needs is necessary, while setting up multi-layered, robust, flexible float pools that can move across an enterprise, a region, or a single facility. These flexible resource pools are critical to allow for expansion and contraction of hours as needed based on the patient care and seasonal trends. Organizations are getting creative about how they are implementing, employing, and maintaining this critical strategy. We're excited to share more with you today. So with that said, I'd like to pass it to some of my fellow panelists to understand the different models we're talking about today. Starting with you, Angelo. What models are hospitals exploring? For example, let's talk about float pools here first. Is that the same thing as an internal agency?
Well, thanks, Leora. That's an interesting question. There's a lot of attention right now on internal agencies. There's a lot of buzz. Organizations are trying different things. And so from my perspective, they're not the same. And I think it's worth a discussion and clarity. So when we think about float pools, it's typically made up of full-time employees that are competent to work in several areas. Many organizations have different layers to their float pools and different specialties, but they are primarily employees of the organization and work full-time in benefited positions. There's enterprise float pools, which work across several hospitals or several buildings or entities. And so, you might have an enterprise float pool for a health system of 5 hospitals that floats between their emergency departments, for an example. And then when we think about internal agency, that's really replicates the 13-week assignment that we see many travelers or agencies doing, but they're employed by the hospital or health system. And now they may do more than 13 weeks, or they're structurally, they might be a little bit different, but it's really a cost mitigation strategy that hospitals are trying to deploy as rates went up during the pandemic. We're seeing some recovery of that now, but certainly not to pre-pandemic levels. And I think we're still learning about how these internal agencies are functioning, how they should be structured. Are we seeing the return on investment that we anticipated from them? And are we counting, some of the back-end office oversight that's required?
Great, thank you.
I would also
Anything else
mention,
you would add?
I would just add that I hear a lot of CNOs use the verbiages around float pool and internal traveler pools and internal agency interchangeable. And while the goal is the same, we want to maximize flexibility. It's very important that we recognize that each of them in their own right have a unique benefit, and that a data-driven approach where we're informing systems of how those layers should be set up and what is appropriate for each individual health system. In other words, we can't just apply this uniformly to any health system and think it's going to work. It's really critical that we discuss the data and specifics of each health system.
That's helpful. Thank you, Angelo. I'd be interested to hear your perspective on the advantages of building an internal float pool.
For me, it's really about flexibility. It's about nurse satisfaction. It's about creating an environment that your employees want to work in. And so we know that nurses now are looking for different types of schedules, different type of work-life balance coming out of the pandemic. And so primarily, it's about a more flexible workforce so we can meet the patients where they are and better position us to mitigate burnout. I think the bottom line is that we want nurses to work in their home units where they want to work, and we want nurses who want to float to be able to float. and not crossing those lines. So I think that's really critical. We know from history that a float pool sized correctly for an organization really helps decrease the need for nurses to be pulled, and it increases the flexibility that the hospital has to take care of patients in the right place.
Absolutely. Absolutely. So how do we start? How can hospitals get started if this is something they're interested in pursuing?
Yeah, great question. You know, we're taught in nursing school, assessment is primary, and part of that assessment is collecting data. And so I would say collect your data. You really need to understand the needs of your hospital and health system, how it's structured today. Most hospitals and health systems try to apply, consistent replacement factors when we know there's great variation even between units. And so getting granular about your replacement, understanding your staff's wants and needs, it does you no good if you prop up an internal agency and lose 25% of your staff to the internal agency. And so really having, the steps sequentially laid out so that you're systematically moving towards your goal and you understand the impact of each increment. You can best position yourself to do that with some of the analytics, some of the predictive modeling that we have. And that will also help you size your internal agency appropriately. One of the most common things that we find is that hospitals build out these float pools or these internal agencies, and they're just too small for their organization. And so what you end up with is a great intention and a great first step, but it's inadequate. And so you often sit around thinking, gosh, I did what they said, but it's not working. So therefore it doesn't work for us. When in fact, it's really just too small.
That makes sense. So how might that strategy change or scale with that hospital size? For example, are there different considerations for smaller or larger facilities?
Absolutely. So what we have to understand is that every hospital and health system is different. Their seniority bands are different, meaning where their nurses fall in their seniority and experience is different. That impacts how you're going to build your float pool. At the end, it's really about making sure that you're taking every piece of data that you can get, specifically around how your nurses are using their time off. How much FMLA do you have? These types of things that impact, and you're building that float pool to the right size for your hospital. And so if you're uniformly, again, applying a non-productive rate, and typically what you hear is 16%, 20%, 24%. If you're uniformly applying that, I can almost guarantee you're cutting your float pool short. So you really have to be strategic. Think about your vacant positions, the size and scale, and how you're going to sequentially build that float pool. The other thing I would say is it's critically important to recognize that you have subspecialties. And some of those subspecialties require a float pool of their own. One of the most common is your emergency departments. So build out an emergency department float pool that can go between your EDs. And so these are some of the things that we're thinking about and working with organizations to build out.
Great. Perhaps you can talk a little bit more about the role of data and analytics when it comes to developing a float pool.
Yeah, I think you really have to know where your starting point is before you know what your goal is. And so if you're sitting in your organization saying, I'm building a float pool tomorrow, I would caution and say, really understand where you're at. Take a deep dive into your workforce trends, get some dynamic perspective about how your workforce is going to look into the future, how your patient volume is or is not going to change, and then make sure you get help laying out those layers correctly. The level of information that you need for these decisions to be able to right size It's really about getting it in the right time at the right cost and making sure that you have the right resources. So we're talking a lot about float pools and internal agencies, but also right sizing your full-time and part-time. I can't tell you how many organizations we see a nurse leaves a unit today and they right away post that position in the unit, when in fact we probably know their float pool's way undersized. We should probably think about moving some of those FTEs to the float pool. I think when people think about consultants in the workforce space, we think about cutting FTEs. And that's where I think AMN's approach is different. We're not looking to cut FTEs. We're actually looking to balance and right size those FTEs. And really what it often requires is just some shifting and moving. We also advocate that we're not going to make a nurse move. We're going to lay it out strategically. We know the turnover rate, and we'll leverage that turnover rate to get people in the right seat on the bus.
Thank you. What are some common pitfalls or challenges transitioning staff to a float pool arrangement? How can leaders work through them?
Well, I mentioned that oftentimes when we build these float pools out, we see hospitals undersize them. And that is true of internal agencies, it's true of float pools. What is also true is we have to do just as much work on analyzing the data. We also have to do that same amount of work on keeping our staff informed and communicating the plan, letting them know what we're anticipating, and most importantly, getting their feedback. Now, change is always hard. And so these take incremental steps to understand, and we really have to listen to their thoughts on how they think things will work. And we meet in the middle often and come up with a great plan. What we need to help them understand is when nurse A left my unit, why didn't we replace it? I don't see nurse A or a replacement coming in. Why is that? And I think that's where when we lay out the full plan, we lay out how we're going to go about that and the incremental steps we're going to take to get there. Now they can wrap their head around it. And so they don't see nurse A showing up tomorrow, but they see their float pools growing significantly, double or tripling in size. And that gives you great flexibility.
Can you share a client experience with building a float pool?
I think I can take that one. Yeah, so in one of our client relationships, we started with an existing pool of 300 people when we first partnered. And in their initial state, they were communicating needs through email and a weaker scheduling system. They also had internal staff that worked and picked up shifts for other facilities in their healthcare system through an agency relationship, simply because there was no method of communication between the different facilities in the healthcare system. So once they implemented the VMS solution, they slowly increased their float pool to over 2,000 providers and were able to share needs in real time with all their staff. Then they added internal process and other requirements on the number of hours that each internal resource pool member would work, which equated to the hourly rate paid to the provider. So the more hours the provider committed to per month, the higher the hourly pay rate would be. And over a 24-month period, they were able to save more than $5 million in agency spend in an annualized review by really just sharing and filling those needs with internal resource pool candidates in advance, rather than needing to go directly to the external agency labor.
Wow, that's a great example. How can technology help to source and engage talent in this important process?
Yeah, so we really understand our healthcare clients' needs towards providing better access to care through their patients through different delivery models, and the importance of optimizing their workforce to not only acquire but retain a balanced labor pool through permanent placement, contract labor, flexible internal resource pools, and new core staffing models. And we continue to make significant progress and investment into bringing several of our workforce technology platforms together. So we're improving access to care through our telehealth and language services platforms. We're supporting client talent management needs with our clinician mobile app and cost containment strategies with our advanced supplier network. So really, here's a quick overview of sort of the total talent ecosystem, if you will. It really consists of our workforce strategy and optimization solution, combining that with both our workforce management and engagement offerings. It's kind of like an all-in-one solution that gives healthcare organizations the ability to predict and then plan their workforce needs in advance, and then source the talent that they need to staff in a tiered method so they ensure that they have an optimized and an engaged workforce mix, a real mix across the labor pools.
Zach, can you walk us through a demo of the technology, please?
Happy to do so. So let's go ahead and share my screen, and we'll get started. 1 second here. There we go. So I'm going to start where Michael just stopped. We're going to talk a little bit about our mobile app and how we connect with our clinicians, creating and supporting a community that does drive the orders to them and helps them interact with things that they want to accomplish. So what I'm sharing with you today is a web portal version of our Passport application. Passport application has almost 200,000 downloads with 40 to 45,000 monthly active users. So you can see here that it is an app in both the Apple and Google stores. Download it to your phone. I'm going to go ahead and log in as a clinician real quick here, and we're going to take a look around. But initially, you're seeing the experience on my web screen, but on my screen from a web portal, but this would be an app on your phone. It looks very, very similar. A couple of things immediately you'll see is that you have community opportunities. Again, there are highlights, so we can publish opportunities in different locations at different hospital systems, stories about what the clinicians are up to now. One great one here is, why do I come to work? I'm just going to click on it real quick because I want recognition. I did it. That's awesome. That's great. Again, blogs and stories as they communicate with each other and share information. A great opportunity here to build my brand as a clinician. Things I can do, things that frequently asked questions at orientation. Great thing to learn about. Other opportunities in the industry. But also, what am I doing right now? So there's right here on the top right, I can go out and I can process credentials. No reason finding a fax machine. Take a picture of my most recent BLS certificate. I can go ahead and load it onto the app, get right off to my credentialer, and away we go. Also, some things I can do initially on my home screen. Where am I on assignment? What jobs am I looking for? What's my next opportunity? And this could be inside of a resource allocation or a grander scheme of where I want to go travel to next. Again, as we consider that support mechanism with our clinicians, who do I need to contact about things? Perhaps a recruiter for the next spot I want to go to, or opportunities inside of my institution. Also credentialing, clinical managers for support, bill and pay information as well. As I scroll down here on the left, I'm looking for opportunities, and I can filter those opportunities by choosing what it is I'm interested in as a clinician. And I will point out right here, there is a permanent opportunity to look for permanent jobs. As I dig into where I want to work and where I want to become a member of that organization that I want to do today. Just on the left here, just again, more information on support, resources, preferences. There is an opportunity to process time and pay through the application, depending on how it's released and configured. But we do, again, have a great opportunity to build that community, build the opportunity for these different resource pools that I want to go work at, and a great way just to communicate as a whole as part of the organization. And now I'm going to move on to the next thing we had talked about earlier, which is data. Now that I'm able to gather data using this application, I can then start to dig into it. What is the opportunity to use that data for analytics to create a proactive experience based on the information that I know is going on? What I'm going to share with you next are some Power BI dashboards we've designed. This is my demo site and my information that I've been tinkering and playing with it to be able to tell you a story about how I can use that data to make decisions, to work with my colleagues, work with my organization on that up-to-date information. As you can see from the primary view, and I'm going to start to drill down as we move through the tabs on the left, but these are panes of information. So think about looking at a window. You may have a pane of information here and there, and we can move these around based on what the expectation is. This is a web-based application, or technology, so there's no footprint. It is up-to-date information based on the databases. It is opportunity to go mobile enabled if you want. So you can get it on your phone or a tablet, or you can see it again as a website, which I'm displaying for you today. Here is this, you start to begin to tell the story about my organization. This is my estimated year to spend. This is information, again, up to date, what's been going on in my technology, what my fill rate is, how am I doing with filling those orders, how many open positions I have, and how many people are on assignment. Again, thinking about the ecosystem. What am I looking at and how can I use the data? Before I go too much further though, of course, with all of this, we can export and send you on a regular basis this information. But again, you can also interact with it. So maybe I'm headed off to a meeting. I really want to know what my estimated year-to-date spend is based on what I've got going on in my organization. It's immediately here for you without having to wait for that report to come through. All of these areas are dynamic, so I'm just going to choose a couple of different specialties that I want to dig in a little bit more. Notice that my graphs are changing. My fill rates are changing, the clinicians on assignment, what my spend is going to be. And if I want to reset that graph, just clicking in the open space in there, it resets for you. So now that I've got an executive summary, I want to start to poke around a little bit more at what's going on in my units. So here, we'll go to the next graph and we'll take a look at open positions. Again, looking at my fill rate for open positions, and the data is sorted slightly differently. Because as you notice here, I did choose a different date range. I'm not looking at year to date, I'm looking at what's going on right now in this range here, which is a little bit broader. I have 226 open positions, my average days open 32. Just to draw your eye to this, total order lead time. So even thinking about filling shifts, how much time am I giving myself and my organization to fill those shifts? We know with the ability to look out a little bit longer, to have that proactive view based on the analytics, you can make better decisions and pull levers in your organization inside and out that will help you extend that time, that lead time. So you're really seeing a real analytical and projective view of the data based on what you have today. Again, as we navigate around in here, I'm just going to choose a couple specialties to look at specifically, but we see the information begin to change, what my lead time is, and how the information, again, in the graph is dynamic. So it's taking what I'm looking for, it's bringing me that real specific information that's going to help me make a good decision moving forward, and then I can share that decision with my colleagues and share the data. Transparency is a wonderful aspect of this application, and what we're accomplishing is to bring that transparency to bear to provide proactive decision making. Again, as I continue to drill down even further into the information, maybe I'm now looking at a unit level view. I want to know what's happening. Who's coming to me soon? How many orientations am I planning? Who's going to be in those orientations? Seems like a lot over the next couple of weeks. I'm a pretty proactive player in my demo site, so I do have that opportunity. What's really driving some of my decisions right now is this number here on extensions. As we talked earlier in the market, you want to draw that information down, draw those decisions to really reduce the number of extensions and utilization. Maybe that's how I'm building my float pool or my internal agency, is by looking at this and saying, where am I extending these resources? And perhaps even why. If I look at just one specialty, I can see that my organization is doing a really great job in the specialty of a med-surg space. My extension rate is actually 9% over the period that I just talked about, which was about a year and a half. I can see that I have a number of suppliers that are helping me with this, and specifically which facilities are driving that number. And I can choose to just select one of those facilities. And then again, just take a look at that med-surg. It's going to tell me those numbers again. This one facility has a higher extension rate. And maybe I want to talk to that facility about that rate. And we can again begin to use the data to drive analytics to make decisions. The last place I'll stop and then I'll give it back to the presenter team. But here we are on spend. Thinking about what my bill rates are. And again, this is data we're gathering. So there could be different data sources where we pull this information in. From an enterprise perspective, of course, we would secure this in a space where we can utilize it. If I'm looking at just my med-surg resources, as I was earlier, that's my actual average bill rate today. What's really great is I look down here at the estimated spend year over year, and I can see where my last year's spend is and where my current year's spend is. Where this graph really gets exciting is this space here where I can see that actually this year I'm driving that number down. And I'm utilizing different resources to accomplish this. So again, as you look at a way to analyze the data, bring the information to bear and make good decisions, you're working with your internal and external partners to drive those decisions, and you're sharing the same data, which does create a pinnacle and an opportunity to drive that decision-making in the right direction, and the direction that your organization wants to go in. I'm just going to choose a couple of things on this page, and then I will give it back to the presentation team. But I wanted to look at just a few specialties. And if those 3 specialties were the ones that were my primary, I can again see what my average bill rate is going to be. And down here, I'm seeing how successful I've been to drive that year-over-year spend down even lower. And perhaps I want to focus in on just one facility, again, as I did before. You can do that as well. And you can see how your supplier partners are interacting with your organization and with your program teams to support that division of driving that, or the need to drive everything a little bit lower and to make your organization successful. I'm going to just go ahead and pop back up to the executive summary. And then from there, I'll go back out to AMN Passport. Again, this is where your clinicians are interacting in the space, and this is where your organization is interacting with the data in the space. And from there, I believe I'll go ahead and kick it back to the team, and I'll stop sharing. Thank you.
Fantastic. Thank you, Zach. Anything else you'd like to add?
Nothing.
Well, I think one of the things that we learned is, establishing flexible resource pools and shifting your organization's mindset into flexibility is a journey. It doesn't happen quickly. And most importantly, I think one of the things we didn't mention is the importance of executive sponsorship and a steadfast commitment to stay the course. So this is a step-by-step incremental journey to using less agency and getting your spend down, and having dedicated teams that focus on workforce optimization in your organization will help you achieve transformative change and be successful. And what you'll see is some immediate early success. And over the long term, you're really establishing the foundation and framework that'll continually give you return on investment over time. This is, again, a journey. One of the things that I can tell you as being a former chief nurse executive is that I appreciated the partnership with AMN and the comprehensiveness of their solutions, and recognized early on in working with the team that it's much more than a travel company. This is a total solution company. And, we would love to work with your organization, and just appreciate so much everybody joining today.
Thank you all so much. Now I'd like to shift to some questions from the audience today. Our first question is, how do we know if our float pool arrangement is working?
That's a great question. I think you'll know if your float pool arrangement is working when you see continuous declines in agency spend, when you're hearing from your staff as you're rounding, hey, I haven't got pooled in a while. I've been able to work in my home unit. And so I think those are some of the metrics you're going to see. In addition, you're going to start to see an attraction to your organization from staff because you've got the right setup and infrastructure to support their needs. And ultimately, your outcomes should get better with your patients.
Great, great. Another question we have is, are there scenarios where a float pool doesn't work for a hospital?
I think there are some scenarios. So I can think of maybe a critical access hospital who's got a small emergency department and 10 beds, inpatient beds. Perhaps there, a float pool might not be right. Now, if you've got a group of critical access hospitals in a geography that is easily navigatable, then float pools do work. Other than that scenario, we're seeing float pools in outpatient settings. We're seeing float pools in surgical settings. Now, again, the structure may be different because we're individualizing the approach, but as a general concept, I think there are a few places where float pools might not work, but generally, it's a great resource and tool for you to have in your toolbox.
Another question we have is, do you think float pools will continue to be beneficial in the future, even after or if staffing concerns are reduced?
I do. So I've been a nurse since 2001. My grandmother was a nurse in the 60s. And if you do your research about the nursing shortage, you'll find information as far back as 1935. And so this nursing shortage that we are talking about today certainly is structurally a little different than what we've seen over history, but we've never stopped talking about a nursing shortage. And so some of that is because of the way our workforce is built. Now, it doesn't negate the fact that we need more nurses in the workforce. I think everybody's on the same page there. It doesn't negate the need for innovation and transformation at the bedside, but float pools are certainly a thing of the past. They are a thing of the future, and they have a lot of staying power to give you flexibility.
Thank you, Angelo. Looks like we have a few more questions coming through here and some time. I'd like to address the question, what is the difference between internal float pool and internal agency? We hit upon this a little bit. Perhaps we can expand.
Yeah, sure. So an internal float pool, again, is a group of nurses right-sized for your organization that is trained and employed full-time to float to a group of units. An example might be you have 5 critical care units in your hospital, and your critical care float pool nurses, let's say there's 50 of them, are trained and staffed to float in and out of those 5 critical care units. That's an example. Another example might be you have a 5-hospital system, and you have an emergency department enterprise float pool where those nurses float between your emergency departments. An internal agency is typically a group of nurses employed by your organization. So let me back up. Your internal float pool is shift by shift or 4-hour increments. I have a shortage in this critical care unit, I'm going to move them, and then in 4 hours, I'm going to move them to this unit. An internal agency is typically a group of nurses who are going to go in. I have an FMLA on 3 North, and I'm going to send this internal agency nurse into that unit to work for 13 weeks or 12 weeks. And so structurally, you might say, well, but they're both employees. But the way we deploy them is very different. And the size of those 2 groups are going to be very different. And they're both important to meet your needs.
Thank you. We have another question that has come in. How do you avoid staff moving into internal agency positions, thus creating a higher vacancy rate?
Yeah, great question. And this is a concern of every organization as they're trying to build a float pool or an internal agency. I believe that it is good planning, good communication, and balancing the delta between paying your internal agency and paying your hospital. I think it also is important to begin to assess together with the nursing staff who are interested in this internal agency. So think about it. If you lost 25% of your staff because they wanted to go travel, you may lose them anyway. So if we lose 25% of your staff, we want to lose them to your internal agency versus a traveler organization, and we want to keep them in your organization. So it's really about helping them build a career path and having that built into your strategy so that you can effectively plan and then stepping it out incrementally, like I talked about. This is a journey, it's not a sprint.
Well said. Thank you. And this is a perfect segue to another question that we have from the audience on what the best methods to establish right pay rate for internal agency staff recruitment. Obviously, you want to be competitive, but not lead the market. Any insights?
Yeah, I think from my perspective, at AMN, we have one of the largest databases on pay rate in the entire country. So when you look at our partner group, we can drill down into almost every market in this country and give great perspective about pay rate. Now, that is a piece of data that in a partnership will help you understand what's happening in your market, in addition to your own internal organization's data. And you really want to find the fine balance there of what does it take to keep my staff here and not go to travel. And so from my point of view, it's about marrying the pieces of data. I hear many people say when we bring up some of these topics, oh, well, I can do that. I can do that internally. Oh, well, we have that data. We don't need it. What I would tell you the difference is the partnership and the perspective of what we're seeing across the country and how we might help partner with you to apply that in your organization. I think that goes the same with pay rate. Perspective from a national level, perspective from your market, perspective from your organizations. We triangulate those data points and we help come up with the best decision.
I would agree, Angelo. We do have a question related to some geographic disparities, if you will, and that my city has two major hospital networks and some independent hospitals. If one hospital network implemented internal float pools, would they realize the benefit, or would it require collaboration amongst all the major hospitals in that city, that geography?
Yeah, good question. So not knowing what city we're talking about or what hospitals, generally speaking, each hospital could have their own float pool. Now, the layers and tiers of that float pool might look different in each of those hospitals depending on their size and their patient mix. But fundamentally, each one of those organizations can have an internal float pool and should have an internal float pool. When we think about internal agency, then maybe the answer is a little different. Again, not knowing the size of the organizations we're talking about. When we think about internal agency, maybe it does make sense for a partnership to happen there and some cross-pollinating of your internal agency group. But again, we can help partner with you and go through all the data elements and share our data from a national perspective and really come to a conclusion together on that.
Great, thank you. Well, we will follow up with anyone whose questions we didn't get to today as we're running up on time. I'd like to thank our speakers for a great discussion. We appreciate you sharing your insights and expertise with us. And I'd also like to thank our audience for joining us. We hope to see you again soon. Have a great day.